Yes, sir. Yes.
Okay. Sir, is it visible now?
Yes, sir. Yes, sir. Can go ahead, sir.
Okay. Okay. Immunity is a capability of multicellular organisms to resist harmful microorganisms. This is one of the concept or definitions. Another concept is it is a complex biological system that can recognize and tolerate whatever belongs to the self and to recognize and reject what is foreign or non-self. So these two are the main components of the immune system. Third concept is it is a function of certain cells, enzymes, and immunomodulatory chemicals that attack pathogens and prevent them from creating diseases in multicellular organisms, particularly. These are two main components of the immunity. One is non-specific components, like it is inborn, inbuilt immunity, we can say. It acts as barriers or eliminators of a wide range of pathogens, irrespective of their antigenic makeup. So it is a non-specific component of the immunity. And other is specific component where the body adapts themselves to each new disease encountered and can generate pathogen specific immunity, that is disease specific immunity, we can say. This chart emphasizes this brief account of immune system. There are three lines of defenses actually. One is first line of defense is external defense, that is skin and mucous membranes and nasal hair, cilia, some chemical barriers, etc. Second line of defense is like say it is in internal defense, part of internal defense. It works on cellular level, that is phagocytes, then macrophages, then lymphocytes, then inflammatory reactions like wise. And third line of defense is active immunity and passive immunity, that is shortly we can say this is vaccination, this active and passive immunity. So in short, immunity can be divided into these types, like adaptive immunity and innate immunity is like inborn or by birth immunity is innate immunity, and adaptive immunity is can be divided further into two types, like natural immunity and artificial immunity. So natural immunity is passive, like from mother to child. Some antibodies are transferred from mother to child, and that immunity is developed. That is called natural passive immunity. And natural active immunity is like somebody gets one disease, and after that he acquires immunity for lifetime, like smallpox or chickenpox. If someone gets chickenpox once in a life, then that immunity is preserved for lifetime of that person or organism. And in artificial types, there is passive immunity and active immunity. In passive immunity, antibodies are directly transferred to one's blood, and in active immunity, like vaccines are transferred. Like there are various types of vaccines. Some are live vaccines, some are attenuated vaccines, some are sera. So these are, in short, types of immunity. What are the major defects of the immune system? Here, disease can arise when first is what is harmful or foreign cannot be eliminated. We can name this type as a hypoactive immunity or weak immunity, and other part is what is harmless or self tissue or self organs, it is not spared, and we can term this as a hyperactive immunity or autoimmunity that leads to autoimmune diseases like rheumatoid arthritis and SLE and many other autoimmune diseases. So how this concept of immunity and modern medicines evolved? Actually, human beings are born with basic immune system that is perpetually weak, we can say. Then through constant interaction with the microbes in our environment and within our gut, we learn to fight against new microbes and that helps to strengthen our immune system. But in this modern times, particularly during 20th century, concept of this microorganisms and defense system led to development of range of antibiotics and vaccines particularly. And this excessive microbicidal or this vaccines use in the name of hygiene and other things, and lack of constant interaction with plant, soil and other organisms. That means we disturb the natural cycle of the nature, and that gradually made our immune system weaker. Though overall health and lifespan has been increased compared to ancient times. So these three are the challenges against this modern concept of immune system. One is emergence of autoimmune diseases, like that is attack of the immune cells or immune system against own cells or own organs, and that lead to various autoimmune diseases, and these are very difficult to treat. Then widespread antibiotic resistance. This is the other challenge. And third one is as the knowledge grow, there is wider understanding of friendly bacteria and its benefits, especially inside the gastrointestinal tract. So these are the challenges against the this modern science for this concept of immunity. So are there any solutions for these challenges, or are there any options? Yes, there are options. We have our traditional systems of medicine, and Ayurveda is the front runner among the traditional systems of medicines. It has evolved in ancient India since Vedic era, and it is time-tested knowledge. Everybody knows this knowledge of health, wellness, dietetics, diseases, and healing, and that has been systematically documented in Samhitas, which are Sanskrit books or treatises like Charak Samhita, Sushrut Samhita, and Ashtang Sangraha, and many other books likewise. And there is therapeutic use of remedies of herbal, animal origin, as well as there is use of processed minerals and metals also. So these are some strengths of Ayurveda. There is comprehensive definition of health. Then there is acceptance by community, then emphasis on promotion of health and prevention of diseases. There is so much emphasis on diet and lifestyle. Then there is holistic concept of health. There is individualized as well as universal approach of diagnosis and treatment of diseases. And there is stress on public health also. Mainly Ayurveda uses natural products, that is plants, and there are multiple areas of clinical strengths, like the term is Ashtanga Ayurveda. There are mainly 8 main branches of clinical modalities that Ayurveda caters. Medicine branch is called Kaya Chikitsa in Sanskrit, because all Samhitas were in Sanskrit in ancient times. So Kaya Chikitsa is a branch that is internal medicine. Shalakya is ENT. Then Agat Tantra is toxicology. Shalya is surgery, general surgery. Kumar Bhrate is pediatrics and midwifery. Then Bhuta Vidya is microbiology and some psychiatry, we can say. And 2 special things, one is Rasayan branch, that is rejuvenation therapy, and other is Vajikaran. Vajikaran is aphrodisiacs, or it is a health system for healthy progeny or quality progeny. Here is a comprehensive definition of health which is made by Ayurveda. This has been described in Sushrut Samhita. When somebody has sama dosha, there are 3 pillars of the body: Vata, Pitta, and Kapha. Those are called 3 doshas. And for normal body like functions, these 3 doshas are required. So there is equilibrium of all the 3 doshas. Then there is equilibrium of Agni is a digestive fire or metabolic fire. there are 13 types of Agni, that is metabolic fire, and there should be equilibrium among the Agnis, that is digestive power. Then there should be equilibrium among the Dhatus. Dhatus are the basic body tissues. Like there are 7 main Dhatus in Ayurveda: Rasa, Rakta, Mamsa, Meda, Asthi, Majja, and Shukra. These are main 7 body tissues, and there are some supplementary organs. So there should be equilibrium among the Dhatus. Similarly, there should be equilibrium among the Malas. There are Malas, like waste products of the body. There are 3 main waste products. One is stools in physical form, then second is urine, and third is sweat. So these 3 are the Mala. This should be in equilibrium. Similarly, there should be equilibrium, and there should be balance of Indriya, sensory and motor organs. Indriyas are 5 plus 5. There are 5 Karmendriya, 5 Gyanendriya, sensory organs, and 11th this Indriya is mind. So, and lastly, there should be balance of Atma also. So Ayurveda has very comprehensively described what should be the health, or what the healthy person should be, and what are the prerequisites. So there should be Prasanna, Atma, Indriya, Mana. So there should be happiness in the Atma, Indriyas, and Mana. So mere absence of disease is not the health, but there should be happy mind, happy soul, and happy Indriyas also. So this is the overall concept of health as per Ayurveda. Then what is immunity in Ayurveda? In Ayurveda, there are 3 concepts which describes about immunity. First is Bala, because every human being has its inbuilt Bala, that is Janmajat Bala, that is by birth, every animal is born with some Bala, and we can improve it by our diet, lifestyle, and other remedies or some medicines also. That is concept of general strength. So this Bala concept helps in prevention of diseases. So we can call Bala as general immunity and general defense mechanism. Second concept is Vyadhi Kshamatva. This is concept of resistance. This resistance is particularly against the microorganisms that can lead to diseases. So Bala, Vyadhi Kshamatva, and third concept is Ojas. Ojas is, one cannot see the Ojas, but it is present in the body, and it is, we can, in short, we can say Bala is a supreme resilience of the body. This resilience is to any form of the unfavorable physical, mental, or environmental changes which can lead to some certain diseases. So these 3, Bala, Vyadhi, Kshamatva, and Ojas, lead to the healthy immune system of the body. And this preventive aspect of immune system is majorly related with digestive system. So one has to be very careful about the functions of the digestive system. And Ojas is considered as the essence of food we consume, and healthy level of Ojas, Oja or Ojas, this indicates proper tissue nourishment. So this is overall concept of immunity in Ayurveda. So what are the common factors which disturbs the immunity? There are many, but I have just listed down some major causes, like unwholesome diet, that is unhealthy diet, then unhealthy eating habits also. Generally in modern times, we stress only on nutritional diet, then balanced diet. We advise many things that this should be taken, that should be taken, but how it should be taken, when it should be taken, that is also important. And Ayurveda emphasizes on this thing also. Our diet should be as per the individual's prakriti, that is body constitution, then our manas prakriti, that is mental constitution, then the climatic zone we are staying at, that is called desha, and at what time of the year we are having our food or this thing. So that also should change our diet pattern. Then next thing is dehydration or not having enough water or other fluids in the our diet. Particularly in tropical climate like Andamans, we should have very sufficient amount of water, so that this part we can address. Then other part is excessive alcohol use. Then sleep is also very important. In Ayurveda, there are three main pillars: Vata, Pitta, and Kapha, and there are three sub pillars. That is Ahara, that is diet. Then Nidra, that is sleep, and third one is our sexual practices. So these three are the three sub pillars of body. So irregular sleep patterns, that is constantly wearing sleep, then lack of sleep or interrupted sleep, that also certainly leads to disturbed immune system. Then excessive stress. We all know that stress leads to diseases, and it causes mental diseases as well as physical also, because our mind and body is interrelated. And this concept, holistic concept, is dealt by Ayurvedic sciences. Then this stress increases cortisol levels, and it can lead to every possible disease on the earth. So stress management is very important. Then obesity and lack of exercise. So nowadays we generally keep sitting due to our this compulsions of working environment and other things, but we should address this also. We should take some breaks, like from our work, like after every 1 hour we should take a walk for 5 minutes, or we can do our smaller works like own, instead of delegating it to our subordinates. So this physical activity is very important. This imbalances this inertia this imbalances the metabolism and hormonal functions. And certain medications like antibiotics and corticosteroids can also disturb our immunity. So one should take antibiotics or corticosteroids only with the advice of the doctors or expert. Then certainly we have already discussed mind and its effect on immunity. It is called psychoneuroimmunology. This is new concept, and this is influence of mind and our emotions on immunity. This is very crucial thing. Like Ayurvedic concept of Oja explains this impact of excessive anger, then cravings, then worries, then griefs, then exertion, etc. on our immunity. In actually ancient times, there are this Chinta, Krodh, these terms have been described like that. So one should try to keep these things in control and regularly try for this stress management. Then ability to withstand change can only be developed by maintaining a state of equilibrium in the body, mind, and soul. We have already dealt with this. So what Ayurveda advocates for this preventive and health promotive measures? There is concept of dinacharya. It is called daily regimen. One should follow this for this preventive purpose, because dinacharya means what shall we do for our this preventive and promotive health, right from waking up in the morning till going to the bed. It includes our sleep, our diet, our lifestyles, our work. Our work should be actually socially accepted. It should not be like antisocial things. So our work and our earnings should also be ethical and socially accepted. So that can lead to healthy mind. So we will have less worries with all ethical things. So this is a wide concept, this dinacharya. Then there is concept of rutucharya. We should change our diet and lifestyle according to our seasons actually. That is called rutucharya. There are 6 broad seasons like Varsha, Sharad, Hemanta, then Sharad, Vasanta, and Grishma. Every season comprises of 2 months, and 12 months are divided into 6 seasons. So broadly, in Varsha Ritu, there is heavy rainfall. So one should try to keep oneself like one should protect oneself from that rains and that dampness and the contaminated waters. So in Varsha Ritucharya, our general body bala of body generally decreases due to metabolisms and climatic changes. So in rainy season, we should eat light, we should eat healthy. We can practice some langana, that is fasting. Some people do practice that can also be done. Then broadly in Sharada Ritu, there is visheshan of Pitta dosha. So mainly problems related to heat are exaggerated or exacerbated in during the time of October heat, that is Sharad Ritu. So in Sharad Ritu, one should try not to eat like excessive sour, excessive salty, and excessive pungent or excessive spicy items which can elevate our Pitta dosha. Instead, we should have plenty of like Pitta Shamak things like some sweets we can take in that season. Then some bitter tasted fruits and vegetables we can take during the Sharad Ritu to pacify the Pitta dosha. And in Vasanta Ritu, generally there is a vitiation of Kapha dosha. So that can lead to many respiratory problems or other problems related to Kapha, that is itching or other Kapha related problems. For that, one can practice Panchakarma. In next slides, I will deal about Panchakarma. Then our ahar should be very specific, very careful. There are various rules of dietetics in Ayurveda. Some broad rules are like one should eat according to one's appetite or hunger only. We should not overeat. Actually, undereating is better than overeating. So broadly speaking, nowadays we focus mainly on nutrition and other things. Of course, in childhood or pregnancy, nutrition is very important. But in normal healthy adult, diet should be little optimum, I can say. It should not be like overeating. It should be for needs of the body, not for the tastes of our tongue. So our diet should be very moderate, and it should be as per the health advocacy. Then Sadvrata is model social conduct for public health. That is Sadvrata. That has been how to act social, how to actually behave in our family, behave in society for the good. Nowadays, this COVID appropriate behavior that tells us about the Sadvrata of this for prevention of this COVID. So Sadvrata is for social harmony and social health. Like in maintaining personal hygiene, social hygiene, that also comes in that. Then other next concept is Panchakarma. Panchakarmas are cleansing therapies for like it is like regular servicing of our body. Like in automobiles, regular servicing is required for the healthy running of the engine. So these Panchakarma cleansing therapies are required for the healthy functioning of our organs and systems. Then Rasayan therapy is there, that is rejuvenative therapy. This is exclusive concept of Ayurveda. Panchakarma, Rasayan, Vajikaran, these are the exclusive concepts of Ayurveda. Next is Vajikaran, that is therapy for healthy progeny. This is for both males as well as females. So Panchakarma therapy is, there are three parts actually. One is Purva Karma, then Pradhan Karma, main procedure, and Paschat Karma is after procedure. So for Panchakarma, there are certain do's and don'ts, and there are some criteria like who is fit and who is not fit. So everybody cannot undergo these rigorous procedures of Panchakarma. In Purva Karma, there are certain therapies like some fast for some hours or so, then some appetizer medicines, then some digestion, deepan, pachan we say, Generally, spices are used in this, like piper, then trikatu. Then there is internal oilation, that is some medicated ghee and medicated oils are actually given to the patients. Oilation and abhyanga therapy, that is body massage, and then Swedan therapy, that is sudation or fomentation, that is for sweating and in order to open our pores, body pores. Then in Pradhan Karma, there are 5 main procedures. For kapha dosha and for respiratory system, there is procedure called Vamana. Generally, some medicated decoctions or liquids are actually given to the patients after that Purva Karma, and induced emesis. This is actually induced emesis. Patient actually is given some medicines, and after that he undergoes some vomitings like 4 to 6 under controlled conditions. And after that there are certain do's and don'ts, and this actually increases our immunity, and this prevents certain disorders like asthma or allergies of respiratory system. So Vamana is generally advocated in Vasanta Rutu, that is around March and April. So this is Vamana. Then next therapy is Rakta Mokshan. Rakta Mokshan is for generally blood related disorders and blood and skin related disorders. So there are various types of bloodletting. There is general bloodletting through this venous section, venous puncture, and there are certain other traditional methods like with some animals like this leech therapy that comes under Rakta Mokshana. Then there is medicated enemas, we call it Basti. So this enema therapy is very important in Ayurvedic concept. Actually, this is for our nervous system. So though it is given through rectal route, this actually, it is said that our abdomen or digestive system is our second brain. So this medicine through this route helps. So medicines are absorbed through the small intestine, and our nervous problems like hemiplegia, other nervous problems, actually we can pacify or minimize these problems through Basti therapy. All Vata disorders like arthritis, then neurological problems like Parkinsonism, hemiplegias, we administer Basti therapy. Even the persons who have disease can also undergo these therapies, and healthy persons can undergo to maintain the health and wellness. Then next therapy is Nasya. Nasya is nasal instillation of some medicated oils or some decoctions. So Nasya is generally used in nasal ENT problems like somebody has sinus problem or various ENT problems. Nasya is administered. Then in preventive, this advocacy of COVID-19, Nasya therapy was included in the guidelines of Ministry of AYUSH. So these 5 procedures are collectively called Panchakarma. There are various other procedures also like Shirodhara, then Kati Basti, Janu Basti, but these 5 are truly internal cleansing therapies, and there are some additional therapies also. And in after Panchakarma therapy, there are some dietetics therapies, and some we advise them to take some rest for 7 days or so to avoid rigorous works, so that to restore the energy of body. After Panchakarma, generally one is advised to take Rasayan therapy. Actually, Rasayan is, it literally means nutrition at all levels. This is therapy to delay the aging process and to try to remain young and healthy. So this is generally for maintenance and promotion of health. It replenishes the vital fluids of the body. Then it boosts the oja, that is vital force of life, and immune system, and thus keeps the diseases away. It preserves youth and prevents or delays the aging process. 100% preventing of aging process is not possible, but still one can delay the effects of aging, premature graying of hair and other things like process of aging, oxidation and other things. Then it helps to maintain equilibrium of basic body tissues, that is dhatus, for longer periods. Then it helps to improve mental and intellectual competence among the children and youth. Generally, Rasayan therapy should be administered in children and youth and middle age. Generally, it is not effective in older age or after 70. So before 70, one should take Rasayan therapy for this longevity and delay the aging. Then there are some additional cosmetic benefits also. This Abhyanga and Svedana, this increases luster, this complexion, glow of skin, and many more things. So basically, potentiality of body and the sense organs is improved by this Rasayana. Rasayanas are mainly classified into two types. One is Kamya Rasayana, that is for promotion of health and health of the individual, and next is Naimitic Rasayana, that is for cure of diseases. So commonly used Rasayan herbs there are many herbs actually, but very common I am just listing here. Everybody knows Amalki has it is a rich, that is Phyllanthus emblica. Amla is very rich source of vitamin C and other vitamin A also. Then Ashwagandha, Withania somnifera. Amalki Amla fruit is used. Ashwagandha roots are used generally. Then Brahmi, that is Bacopa moneri, entire plant is used. Then Shankha Pushpi, Convolvulus pluricolis. Brahmi and Shankha Pushpi are particularly central nervous system Rasayana. Then Giloy or Guduchi, nowadays it is very popular and useful also. Tinospora cordifolia. There is one other variety of Guduchi, that is Tinospora crispa, that should be avoided actually, because in some cases it can cause toxicity to the liver in higher doses. So any herb or anything should not be taken as a self-advice. It should be taken only after the advice of the experts of the concerned fields. Then St. Madhu or Glyceria glabra, it is also a Rasayan herb. And there are some specific Rasayanas like system-wise. There are just some examples. This is exhaustive list, but I will just read out. It is 343. So I will just rush through it, sir. Bala, Kashmiri, and Varahi. Generally, we use Sanskrit terms, but in scientific community like CIARI, Sida cordifolia, and these scientific names are used actually. Then Kashmiri is Melina arborea, then Varai is Withania somnifera. Generally, these are for strength of tissues and organ. Generally, it is Balya, that is tonic for all the ages and all the this population. Then Pipali is a very specific immunomodulator for particularly respiratory system. So it is used as preventive as well as curative also. So Pipali is very important. Piper longum. Generally, fruits are used, and roots are also used. Pipali mool is also used. Then Lashuna garlic is this is for increasing tissue enzymes in particular cases, or increase metabolism also. It helps to reduce cholesterol and other symptoms of this metabolic syndrome. Other Rasayan herb is Haritaki, that is Terminalia chebula. In general, it is called Harra in Hindi. It is very important digestive Rasayana. It is purgative also. So for eliminating body wastes, actually, Haritaki is utilized. In diseases also it is utilized. But apart from the laxative effect, it has immunomodulatory effects also. Then Brahmi, Bocopa moneri, then Vacha, Acorus calamus, then Convolvulus pluricolis, Centella asiatica. These are specific Rasayanas for nervous system. We call it Medhya Rasayana. So in children, growing children, we generally advocate these 4 Rasayanas. These are used as curative also, but generally in intellect enhancing thing, these 4 herbs are generally used. Then Gugulu is used for this processing of waste products, that is ama or toxins. It helps to digest and eliminate. Gugulu is curative in arthritis and other conditions like hypercholesterol and diabetes also. Then amla and guduchi we have discussed. These are called Vayasthapak Rasayana. These are the common herbs to for the longevity, we can say. Then Semicarpus anacardium, Bhilava, generally called in Hindi. It is useful in autoimmune conditions, particularly like rheumatoid arthritis and some stages of cancer also. But Ballataka has some side effects also, so it should be carefully used in Pitta Prakriti individuals who have high risk of like heat related problems or bleeding tendencies. Generally, it is avoided in them. So better to take under supervision. Then Boveria diffusa Punarnava. In its name itself, it helps to regenerate the tissues of body, particularly regenerating capacity of the nephrons of the kidney. So it is called Punarnava Boveria. It is commonly available everywhere in India. Then Shatavari asparagus is the particularly female rejuvenative herb. Generally, roots are used. It is used in infertility and scanty menses, scanty lactation. It is excellent galactogogue. So doctors of modern medicine also use Shatavari or preparations of Shatavari to improve the lactation in the this lactating mothers. Then it helps to correct the libido among the females, then correct the threatened miscarriage also. Then in menopause and other, like in almost every disease of the lady or female reproductive system, Shatavari is useful. And Shatavari is general tonic also. Then for bone growth and development, there are certain mineral products like or animal products like Pravar, that is coral, then Shankha, Kauri, pearls, then Kukutan Basma, that is calcination of egg covering. This is Rasayana for bone health, that is a direct source of calcium. And likewise for anemia like condition, anciently there was Mandur Bhasma was used. Mandur is the oxidized iron. So metallic ash of that iron with various procedures and cleansing things. So that is for the anemia and other related Rasayana. So what are the general immunomodulars? In general, one should have well-balanced diet. One should have all 6 tastes. Like there are main 6 tastes. One is Madhura, Amla, Lavana. Then Katu is pungent or spicy. Tikta is bitter, and Kashaya is astringent. So all these 6 tastes should be in our diet, but certain tastes should be in limited quantities. Like one should not eat very spicy. One should not eat very with excess sugars, and one should not eat very astringents also. So based on our prakriti and individual body constitution and other things, one should practice this concept of diet. Then use of spices, particularly as per our tolerance, body tolerance, one should have some spice in our diet, like pepper or trikatu we say, that is ginger, long pepper, and this pepper, common pepper. This frames trikatu. And before 15th century, mainly this trikatu was the main source of spices in the Indian kitchens, because this mirch jo hai aajkal ka, that was introduced later. So most spices are antioxidant, and these reduce cell damage and maintain the integrity of the body tissues. And periodic detox plans of Langana or controlled fasting or this Panchakarma, once a year at least one should practice as per the advice of the Vaidyas or doctors. Then use of Rasayana, and for this stress management, regular practice of yoga, pranayam. Actually, yoga, pranayam is part of Ashtanga yoga only, but particularly pranayam techniques are practiced for this mental peace and this mental balance, particularly meditation also. What is general advocacy? Like this is continuation of the earlier slide. This is just very common thing. One should tailor-made our own requirements. One should start the day with like tulsi pipali, fruit of long pepper, and ginger tea to strengthen and clean the upper respiratory tract. Again, this should be avoided. This long-term use of these spices should be avoided in pitta prakriti or heat intolerant patients or persons. Then turmeric and black pepper can be used in meals. These are good antioxidants and immune modulators. Then this helps to reduce ama or toxins also, which can lead to autoimmune diseases. So turmeric can also be used in golden milk. Nowadays, it is advocated for preventive thing also. Then quantity of food should be optimal. One should strictly avoid overeating. Except children and pregnant ladies, nobody should practice overeating. That is the foremost thing which can lead to many disorders. So one should eat on time, like twice a day or thrice a day maximum. And as per our requirement, there is thumb rule actually in Ayurveda. One should imaginary divide our stomach into 4 parts. Actually, 2 parts should one should fill with solid foods, and 1 part with semi-solids or liquid foods, including water, and 1 part, that is 25% of the portion of the stomach, we should keep empty for the that enzymes and all metabolisms and other things. This is thumb rule actually, general rule. Then one should minimize intake of red meat and avoid usage of processed meat, particularly like nowadays this sausage and nuggets and whatever, this bacon, ham. This should generally be avoided because these all things are Western things we have adopted or copied it, so that can be easily avoided. Then amla juice and chawanprash, that can be taken for this extra as an extra antioxidant. Then water should be adequate actually. One should not drink this water in very excessive quantity. This should be optimum. In a warmer climate or warmer season, one should have more water. Generally, some people advise that one should have this much liter of water, that much liter of water. So ideally speaking, there is no ideal rule like that. One should have water as per requirement of one's own body and this capacity and this nature of our work also, because somebody is having some labor work, so his requirement should be obviously more water also and food also. So our requirement of water, food, sleep should be as per our this nature of work also. Then one should follow good personal hygiene and eat seasonal fruits and vegetables. And these two actually Ayurveda advocates regional fruits and vegetables. One should avoid this exotic these things, species and foods. And lastly, we should manage our stress. I think we have 10 minutes more. So, sir, now onwards, I have concept of this infectious diseases and COVID-19. Sir, shall we cover this, sir? Director, sir?
No issues.
Please.
Okay, I will proceed, sir. In concept of infectious diseases, suppose almost in all infectious diseases, there is description of jwara or fever. In Ayurvedic concept, I am describing. In certain toxins also, because any infection leads to toxins, then this cause is krimi or microbes for any infection. That was known to Ayurveda also. Then these seasonal regimes and diseases actually were described. And lastly, full-fledged concept of epidemics or Janapada Dhvansa is also described. So this epidemics is not new concept because it existed in ancient times also. So Janapada Udvam. Janapada is some village or some town or some state, we can say. So Udvamsa of Janapada is epidemic or pandemic. If it is on very large scale, it is pandemic. So Janapada Udvamsa is the term. This is mainly described in Charak Samhita. Charak Samhita was completed in 2nd century AD by Maharshi Charaka, and he mentions the important source of microbes spread through air, water, and land. So these three sources of this microbial contaminations were known at that time also, and this is most relevant in current era also. Not just because the infection which spread through the means, but overall impact on soil, water, and air due to this modernization and human exploitation, this climate change and excessive usage of antibiotics and other chemicals. And most recently, this COVID-19 pandemic, everybody knows this, what is name of virus, from where it this originated, and common symptoms and how much cases, because media has kept us very literate on this. AYUSH measures in COVID-19, I will just go through this. AYUSH ministry has extensively advocated and issued guidelines for practitioners and for government machineries for prophylaxis, that is prevention, then for management of mild to moderate cases, then home isolated COVID positive cases, then diet advice for positive cases, yoga practices, and post COVID management. There were periodic guidelines, like very frequently, like after every month or every change of that strain of that virus. So time to time, these all advisories are available on the website of the Ministry of AYUSH. So these are some advisories for common public, like general measures for maintaining the immunity, general immunity. One should drink warm water throughout the day as per the individual requirement. Then daily practice of yoga, pranayama, meditation. At least 30 minutes one should practice, because in lockdown period, yoga was the good actually stress buster for many people. Then spices we have already discussed. Then in remedies, Chyawanprash 1 to 2 teaspoon, because Chyawanprash is the polyherbal formulation, and it contains around 52 herbs. Main herb is Amla and other herbs like for immunity. So Chyawanprash can be generally taken by all age groups and all all seasons, all prakriti. Everybody can take Chyawanprash with advice, of course, with the advice of the doctor. Then this Kada was very famous. It was advocated by our Honorable Prime Minister also. This herbal tea made up of this tulsi, dalchini, kali mirch, shunthi, and munakka, and good as per jaggery, as per the taste and this preference. Then golden milk. So these were some common. There were some simple Ayurvedic procedures like nasal instillation of some oil, like plain still oil, sesame oil, or ghee also, 2 drops in each nostril while a person is laying down. So that created protective barrier for not only COVID-19 but other viruses, bacteria also. So this nasal application, nasya, is part of our dinacharya. It should be practiced. Then oil pulling therapy, that is gandusha, for health of our this mouth and throat. One should practice this gargling therapy with warm water and some triphala decoctions. That is actually when viruses are just lodged in throat only. So it help to just control the infection at that level only and avoid the complications like pneumonia and other serious conditions. For dry cough or sore throat-like conditions, steam inhalation with fresh leaves of mint and ajwain was advocated. Then clove powder mixed with natural sugar or honey can be taken 2 or twice or thrice to control the cough and throat irritation. These were the guidelines for COVID-19 cases for caregivers, actually high risk groups, we can say. Font is little smaller But there was Ayu Raksha kit, which included one Chyawanprash, then Ayush Kada or Quat, then this oil for nasal installation, Anu Taila, and the fourth one is tablet Giloy or Samshamani Vati. That became very popular not only in our country but worldwide. So, and these were the guidelines for positive COVID-19 patients, which were under home isolation, or because in many states there were wards were full and many patients were forced to stay at home only. For asymptomatic COVID-19 positive cases, we used AYUSH 64 capsule. Actually, this was developed by CCRAS, Central Council for Research in Ayurvedic Sciences, Government of India. It was developed initially in 1982, and it was for anti-malarial use. So this was applied application, and initially clinical trials were done, and at least in 5 to 6 clinical trials, it gave very good results and good tolerance also. So this was actually this AYUSH 64 was promoted directly by our Government of India, by our Honorable this Minister of AYUSH. It was launched, and similarly in Tamil Nadu, particularly Siddha system, Kabasura Kudineer, that was very famous, and it was extensively used in Tamil Nadu. AYUSH 64 main ingredients were Picrorhiza gurova, Putki, and second one was this Caesalpinia crista. So till it is used in various viral infections, and some other preparations were like Sudarshan Ghanavati in febrile illness or fever conditions. We generally use it, and Beushadi Vati also, and there were many other formulations also, but this was generalized. This was dietary advice advocated by the ministry for COVID-19 positive cases, like chewing small piece of ginger with pinch of rock salt 15 to 20 minutes before food, because appetite was hampered. First thing was hampered was appetite, then body ache. So to improve the appetite and hunger, this ginger and this rock salt was advised. Then adequate warm water regularly. Then light to digest protein-rich food preparations. Particularly, it should be protein-rich and light to digest. Like mainly, it should be semi-solid, like soups of moong dal and lentils, like ganji in South India. Then vegetables, meat soups. Then boiled eggs for protein supplements. Then khichdi of rice and moong dal. Fulka with cow's ghee, because consumption of ghee is also very essential for immunity. Milk, ghee, as per tolerance, should be taken regularly as per one's health condition and tolerance also. Then vegetables like ghiya, turai, bhindi should be taken for easy digestion. And use of condiments or spices like jeera, garlic, coriander, ajwain as per the health condition and tolerance. Some people had severe acidity, burning. So we used to advise to avoid spices in those conditions. And after appetite and digestion improves, start with normal diet with adequate quantity. These were general lifestyle modifications which were part of dinacharya, like wake up early in the morning around 5 to 5:30, then drink warm water in this stored in copper vessel preferably. Then attaining nature's calls on time, because this also suppressing the nature's calls is also one of the major reason for the major cause of the diseases. Then cleansing of face and oral cavity during the COVID conditions, of course, this was advised. Then cleansing teeth and tongue with astringent toothpaste like Triphala and other astringents like Vajradanti, if possible. Then frequent gargling with warm water added with salt and haldi for throat this thing, and avoid further complications like lower tract infection. Then installation of anutel or 2 drops of anutel then oil application daily in head, ear and feet for mental health also, and light physical exercise as per the health condition. What was the post-COVID advice? Because even COVID has almost, it is now under control, and many people still have some health conditions, COVID positive cases. So for that, one can have Ayush Kwath with advice of the doctor, then Samshamani Bhatti, then Ashwagandha and Pippali. Ashwagandha and Pippali is the rejuvenative thing for restorative tonic, we can say. So that was advocated. Amla, then Mulethi and Chawanprash to regain the immunity and strength. And Ayush Ministry had launched this app way back in 2020. So all these advisories were made available to common public through this Ayush Sanjeevani app in various languages. This is a specimen of Hindi language. So all these advices, so I also would appeal everyone to just go through and download this app and just go through the detailed advisories. So I think with this, Sarve Bhavantu Sukhinaha, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kaschit Dukha Bhag Bhavi. Once again, I would like to thank respected director sir and all the organizing team. And I think with this, I conclude my thoughts.
Thank you, sir. Thank you for your informative lecture on the intricacies of Ayurveda. Now the presentation is open for interaction.
If any questions, sir, if time permits, then welcome.
Yes, I am having one question actually. You are telling that AYUSH 64 is actually effective against malaria. Okay.
Yes, sir. Yes, sir.
It can cure both the malaria, both the peripheral malaria as well as cerebral malaria.
Sir, it was mainly for out of 4 variants of that Plasmodium. It was mainly for Vivax variety, not this Falciparum variety, because that is very severe. And in clinical trials, mainly in Vivax, it was found effective. And after that, in dengue and other viral conditions, many trials have been completed and published also. And many trials are underway also, like multi-centric and multi-organizational trials are also underway.
Another question of mine, last question, that this AYUSH 64, can you use for the as a poultry medicine? Because you are telling about malaria, na? Malaria,
Okay.
malaria. It is an epicomplexan parasite, and poultry is also affected by an epicomplexan parasite which is known as coccidia. Can we make a trial with you?
Sir, actually, ours is the service department, sir. We cater public health services mainly. So we have our hospital, but there are some lacunae, like we don't have institutional ethics committee here. So maybe in future we can address these issues and go on, sir.
Thank you.
Sir? Kalyan, sir.
Sir.
So one Dr. Nivedita Naik has asked if drinking lemon juice in warm water in morning is beneficial or not.
Lemon juice one can take, sir, because lemon is actually advocated in all the body constitutions, and it is part of our diet also. So warm water with lemon juice, no problem, one can take, but its quantity should be moderate one. Like some people advise or practice like 3 liters of water early morning. That is not actually healthy practice. Like glass of half glass or glass of water, that too regularly, one can definitely take that. In fact, it helps to that digest ama, that toxins, and it up to certain extent it helps to check our weight also.
Thank you, sir. She has another query, sir. She wants to know the ingredients to make kadda drink for boosting immunity.
Ingredients of
Kadda, K-A-D-D-A.
kada. Kada. Actually, I will show that slide, sir. Just a minute. Screen share, screen share. Okay, I will tell. So it is ginger,
Nivedita?
ginger, dalchini. Sorry, just a minute. The slide has just stuck back. Jana hai. Yes. Sir, this slide is visible. I think it is visible. The second slide bears the composition of this kada. This is made up of tulsi, dalchini, kali mirch, ginger, dry ginger, and munakka, and jaggery. One can add, like as per if somebody is not diabetic, one can add jaggery also, and fresh lemon juice for taste. And this should be taken around for 15 days. And this should not be taken in very large quantities, because most of the ingredients are these spices, and these are pungent spices actually. So these can cause some toxic effects also in larger quantities. And so only once a day, that too around 150 ml. And generally for 2 weeks. If somebody has to take for longer times, one should take some breaks, like for 15 days, then some break, and then after 15 days. And if possible, some Ayurvedic Vaidya can be consulted. This advisory is available on the website of Ministry of AYUSH also. So I would urge everybody to just visit website of Ministry of AYUSH and just go through the detailed advisories also on Dinacharya and Rutucharya also, because due to time constraint, it was not possible to cover each and everything.